Welcome back to this episode on mental health. In the last episode, we discussed about the depressive illness. In the present episode, we shall discuss to the other pole of this depressive illness, namely bipolar mood disorder. The neurotransmitter which causes major depression and the bipolar mood disorder is the same, namely serotonin. Depression is caused because of the decreased level of serotonin. Bipolar mood disorder is caused because of the increase in the serotonin levels. This illness is the polar opposite of depression. In depression, the person is feeling sad. Here, he is feeling unduly happy. The person is euphoric. The person is ecstatic. The person is elated. Euphoria means a false sense of well-being. Elation means infectious gaiety. The person keeps on laughing and makes others laugh by his antics. The person may at times have an opposite mood, namely angry, irritable mood, in which case the person is going to be very querulous with others. He gets into arguments, gets into fisty fights, gets into trouble because of this tendency of his. Apart from this, there are other major symptoms which characterize this illness. But this is the main symptom. At the mental level, there are too many thoughts crowding the mind. In depression, you had a blankness of mind. Here you have overcrowding of thoughts. And the person wants to express all these thoughts but cannot keep pace with the speed at which the thoughts are occurring. So, to be able to express everything, he talks very fast. There is pressure of speech. There is verbosity. This fastness in speech may go to such an extent that it will lead to what is called flight of ideas. Meaning, the person jumps from one topic to another with a very superficial connection. Because by the time he finishes expressing one thought, another thought is cropped. So he now jump to the second topic. And it may go on so very high that in the end you may not even be able to make out what the person is saying. And that is called word salad. There is a lot of talkativeness and you cannot understand head or tails of what he is saying. In this, there is psychomotor acceleration. In depression, we found there was psychomotor retardation. There was slowness of all activities. Here, there is fastness of all activities. The person moves very fast. He is a very busy body and does not need rest. He is over-energetic, over-enthusiastic. The person will be spending too much of money. He will take huge risks. One patient's wife told me that the husband, who was the patient, used to ride a bike between two trucks. Not only physical risk, they'll take financial risk. One patient of mine took a loan from the bank in the hypomanic phase, which he could not repay during the depressive phase. And now he had a debt of 17 lakhs. When I narrated this to another patient of mine, he said, that fellow lost 17 lakhs, I lost 1 crore 70 lakhs. He had a printing press of greeting cards in West Bengal and he had come down to Mumbai to open sales center. And he would keep on opening up the sales center, right, left and center, and his wife would plead with him, we cannot cope up with this. He would not listen. Ultimately, he lost 1 crore 70 lakhs. So there is a lot of financial risk also being taken. The person may even turn to addiction because he is feeling very good. He wants to enjoy more. There will be alcohol and other drugs of addiction. He will also have promiscuous sex. the libido is more. In depression, the libido is less. In hypomania, the libido is more. And that is why he gets into all sorts of affairs. These patients do not feel that there is anything wrong with them because they are enjoying. However, the illness can be not only harmful to themselves but to others as well. The sleep in this illness is also reduced. However, the energy levels remain intact. The person sleeps for short hours, may go to sleep late, may wake up early, and also wake up others. Why are you sleeping? Let's get active. The appetite can increase, but at times can also reduce. And because of the increased appetite, there may be weight gain as well. These patients do not only harm to themselves, but to others as well. When the intensity of this illness becomes more severe, the person may also suffer from delusions. Usually there are delusions of grandeur. The person feels that he is a great man, he is a very rich man, he is a famous man, he has connections with the celebrities. He may say that Mukesh Ambani owes me 5 crore rupees. He may consider himself to be God as well. So these are delusions of grandeur. There can be delusions of love, where the person feels that some celebrity is madly in love with her or him, and other people in the society are jealous of that and are preventing him from meeting the beloved. The treatment of this illness is to give mood stabilizers. They will keep this illness under control, and again, it has to be given for a period of 4 to 6 months. Unless it's a case of short cycler. Sometimes what happens, in short cyclers, there are rapid changes of mood. So before you can switch over from the mood stabilizer to the antidepressants, the illness is already out. So how do we manage such cases? Then we have to give both the antidepressants as well as the mood stabilizers, so that the low phase is taken up, the high phase is taken down, and there is a straight line. These illnesses also tend to recur. If they recur more frequently, then we have to resort to what is called maintenance therapy to prevent future recurrences of these episodes. It all depends upon what is the course and the outcome in a given individual. Not all patients may require maintenance therapy. It is usually resorted to after the third episode. After the first episode, after treatment for 4 to 6 months, we may gradually reduce the doses of the medicines and then stop them. But if they recur more frequently, then we have to give them also maintenance therapy. Like in depression, in refractory cases of mania, we can even resort to electroconvulsive therapy.
Is it every person who has depression is bound to go in mania? It's always like that, or person can have only depression?
The person can have only depression when it will cause major depression. When the person has hypomania only, it is called bipolar mood disorder 1. And when he has both depression as well as hypomania, it is called bipolar mood disorder 2.
Doctor, bipolar is followed by depression, or depression is followed by bipolar?
Either.
Okay.
They come one after the other. So whether the person starts with a depressive episode or a hypomanic episode is immaterial.
And they have to be treated separately, or both treatment is same for both depression as well as bipolar?
In depression, you will require medicines which will increase the serotonin levels. In bipolar, you will require medicines which will lower the serotonin level.
So both are different treatments.
Opposite. When there is an excess treatment in depression, it will be a drug-induced hypomania. Luckily, the mood stabilizers, even if they get excess, will not induce a depression, except for a few medicines which can cause depressive episode.
So, what is the age where it is seen commonly? Is it seen in children as well, bipolar disorder?
Like in depression, the usual age of onset is late 20s, early 30s. But since last few years, we have been seeing them even in children. My youngest patient is 1.5 years old.
1.5.
Bipolar.
Bipolar.
How was he detected?
By his crankiness. He would keep the parents on toes. He would cry a lot. He couldn't speak at that age. So we'll point out to the doors, wanting to be taken out. Once they're out, he'll point out to the door to be taken in. He would keep on making various demands. He himself was very restless and used to get irritated and angry. The parents really were confused. What is that the child wants? They had a very tough time dealing with the child.
Sir, I have seen many kids of such kind of behavior. But I was not knowing that this is the root cause of this behavior.
With this thing in mind, I mean, there are many other illnesses which are seen in children, common being the ADHD, attention deficit hyperactivity disorder. So, what is the difference? Like, ADHD and bipolar, how does one realize it?
True. In ADHD, it is because of the maturational lag of the cortex, the highest center in the brain. And because of this lag, the control over the lower center is lax. And due to which two main symptoms arise. One is attention deficit, that is, the person is not able to sustain attention for a pretty long time on any activity that is doing, and physically there is overactivity, hyperactivity. This illness usually, by and large, reverts itself between the ages of 12 to 16. The bipolar mood disorder usually starts much later. However, I have seen one such connection that many children, when they have attention deficit hyperactivity disorder, later on in life develop bipolar mood disorder. Now, whether there is any causative relationship between the two is a matter of research. So, in the present episode, we saw something about bipolar mood disorder. In the next episode, we shall talk about another major illness, namely schizophrenia.